Doctors, what's a patient you talk about at every party? This guy told me that he wasn't fat, but I could clearly see that he ripped open through his compression shirt tank. He looked like he hadn't seen grass in years and like he was clutching onto his V-card for dear life. The man had busted through his shoes, skinny jeans tighter than a nun's cooch, a beer belly that shined from grease, and a nice chewed baseball cap to mask his neckbeard. When a patient comes to me with a weight issue, they usually try to clean up their appearance because they feel bad of how their frames look. But this guy was incredible. It was like he just rolled out of his bed when the camera crew left from filming his My 600-Pound Life episode. The kicker? Homeboy was only 21. If you're that young looking the way he did, something is definitely wrong that he can't control. It could potentially be depression, a food addiction, or even insulin resistance. I decided I'd put my judgments aside and try to give the best help I could to this patient like I would any other. I ran some tests and he had nothing predisposed to him that would cause his obesity. So after I grilled him for about 20 minutes, he coughed up the fact that he has a terribly nighttime eating problem. This guy door dashes buckets of lo mein noodles and then double dashes multiple pints of ice cream per night. I mean, who only eats lo mein and ice cream? Dude, at least get orange chicken too. Anyhow, it was clear that his problem was binge eating at night, but it was like he kept convincing himself and trying to convince me that what he was doing was normal. That was so far from the truth. What he didn't know was he was taking his own life away slowly but definitely surely. Nighttime snacking is dangerous and it's something you almost can't get rid of. Your body needs to naturally consume as many calories before bed. I told my patient that we needed to tackle his absurd appetite. When I took a better look at them, the matted hair, the eye bags, the acne, the odors, I'm no psychiatrist, but I'm almost sure that they were going through the fullest extent of their depression because of their nighttime appetite. I recommended that we start taking preventive measures and reintroduce new eating habits. As a precaution, I asked him if he was allergic to anything and he said he was allergic to water. I was a bit confused, so I asked him what kind of reaction happens when he drinks water. He looked me dead in the eyes and said it made him pee. Unfortunately, that is a feature of the human body, not a bug. I didn't think I would ever have to explain that to a person. Anyway, I recommended black coffee before bed and heavily suggested water as well to kill his appetite because something told me he wasn't drinking any water. I told him that if the coffee didn't work I'd look for something else. Somehow, my patient came back 3 weeks later 15 pounds heavier. He said he couldn't get past the bitter taste of black coffee and he was constantly craving 40-piece chicken nuggets, so he gave up and went back to his old habits. Luckily for him, during that month period I had found night food cookies, which were completely healthy to eat at night. I was testing its effectiveness because they're low in calories and are meant to be eaten past midnight, unlike other junk foods. Also, they're the perfect Chips Ahoy dupe for those of you who struggle with binge eating. I ate them every night and didn't see any changes in my weight or feel unhealthy, and I was getting better sleep whenever I ate them. So, I had just the thing for my patient, and recommended the night food cookies with complete confidence. His eyes glowed when I showed him cookies. This was like striking gold. Eating cookies to lose weight? His big back snatched that bag out of my hands. 3 months later, he came back for his appointment, and there were so many noticeable differences in him. He said that the cookies helped regulate his sleep, so he always woke up ready for the day. He told me that little by little, he was feeling better every day instead of waking up depressed. So, he was motivated to work out and start taking care of himself. He went to the gym 3 times a week, and since he wasn't binge eating so much because of the night food cookies, he started eating in a caloric deficit. He also shaved his matted hair off, and he said he felt so much relief when he took that load off of his head. And he was eating more healthier foods than just the night food cookies, so his acne was clearing up. Not to mention, he didn't smell bad, which meant he finally got the energy to shower regularly. It was nice seeing him be put together. Though, the best part came when he stepped onto the scale and he had dropped 20 pounds. With his weight, you could barely tell, but it was impressive and such a huge accomplishment for him. He was proud that he was finally losing the weight and was happy he didn't have to get rid of his nighttime snacking. I could instantly see he was on the path of rebuilding himself. So from then on, I always recommend night food cookies to people who struggle with nighttime binge eating. It's patients like these that remind me how much I love my job, even if they lack common sense.